for this free live webinar on strong bones and smooth joints. We're going to talk about the truth of osteoporosis and osteoarthritis, what the difference is, and the daily habits that protect both conditions. How can you prevent it? How can you live with osteoporosis and osteoarthritis? So what we're going to cover tonight is why osteo confuses everyone. So people hear that word osteo and they think it's maybe arthritis, or maybe it's bone weakening, or what does it even mean? So osteo is a term that's a Greek term to refer to the bone, and it's a prefix. So the prefix osteo meaning bone, but then the suffix of the word porosis or arthritis describes the condition. So it's important to understand how the word is derived, and then we can make a diagnosis from that word. Number two, rusty joints in plain English is osteoarthritis. So your joints start to break down, they get rusty, and they don't work as well. Sometimes you hear some noises like clicking and popping in the joints. Sometimes it's just really stiff, especially in the morning, to be able to bend. Weak bones, like osteoporosis. And osteoporosis is when the quality of the bone, the density of it, is diminished. There's less calcium. The bone can break down. It can get weak. It can break. And so that's what osteoporosis is. The good news is that there's daily habits that can prevent both, and there's ways that you can work with both. And I'm going to tell you more about that today, as well as I'm going to share with you the new book that we published on Amazon on this condition, osteoarthritis versus osteoporosis. We're going to talk about a 30-day plan that you can do to start to improve your health. So same prefix, different problem. One's silent, the other is noisy. Guess which one is the silent one? That's osteoporosis. The other one that's noisy is the osteoarthritis, because you can hear some noises coming out of your joints. One affects the bones, that's osteoporosis. The other affects the joints, that's osteoarthritis. One is found on a scan, like a DEXA scan, that's osteoporosis. The other one you can see on an x-ray, or you feel it every morning, and that's osteoarthritis. Until you can tell them apart, it's almost impossible to know what to do about either one. So weak bones versus rusty joints, two everyday names for two very different conditions. Weak bones, osteoporosis, the bones are affected themselves. The symptoms, there's usually none. It's kind of a silent disease found by a DEXA scan, and the best treatments are strength, nutrition, and fall prevention. So we'll talk a bit more about that. And if you're really interested, I would encourage you to go to Amazon and get the book, either the ebook, we have a paperback, and the audiobook version of this. Rusty joints, that's osteoarthritis. And what's affected are the joints themselves, the cartilage. It starts to break down. That's the covering of the bone. It can cause some pain, stiffness, and swelling. It's found by the history, exam, sometimes x-rays. The best treatments are movement, strength, weight, and manual care. For osteoarthritis, rusty joints, 1 in 7 people have this. So adults over 40, they have some form of osteoarthritis, 1 in 7. It feels like morning stiffness that eases in 20 to 30 minutes as you get more mobile. Ache after sitting still, what I call the couch test. So after you've been sitting on the couch for a while, you go to get up and move around, it's aching. It's worse after a long day or an active day. So if you have a very long day, then it can get worse. It often grinds or clicks. Usually that's harmless, but it's making noises and it concerns people. Usually one joint is the troublemaker, not all of them. So usually it's, let's say, your knee joint or your hip joint. Usually it's the weight-bearing joints I find that have more osteoarthritis. That would be like your hip, your knee, your ankle, sometimes the fingers too, can be affected, or the shoulders, but the weight-bearing joints in the legs usually are affected first. Weak bones, osteoporosis. 1 in 3 women over 50 will have a fracture, and because of osteoporosis. So it's called the silent disease. There's no pain, no stiffness. You feel fine. Often discovered after a fall or a fracture. A loss of height over the years is a clue. There's a family history of hip fracture. So it can be tied into the genetics and diagnosed by the DEXA scan. So it's good to ask your doctor for that. Sometimes we can do x-rays and see osteoporosis, but it requires at least 30% bone loss for us to see it on an x-ray. The truth that most people miss: bones are alive. They rebuild themselves daily, which means they can get stronger even later in life. The good news paradox: there's 2 different problems, but almost the same daily care can help them. Most of what protects your bones also protects your joints. So movement, very important. And sometimes I find when people are diagnosed with osteoporosis or osteoarthritis, they get scared. They don't want to move. So they kind of shy away from exercise because they don't want to hurt themselves. And on the contrary, you do want to get more active, because if you are, you're going to build up some better quality of the bone and the joints. Strengthening, 2 short sessions a week. So we know now from research, the more you do strengthening and build up the strength in the muscles, challenge the bones, the better the quality of the bone is going to be, the denser it's going to be. And also it's going to help to get that lubrication going in the joints, the synovial fluid. Eat to build. So protein at every meal. Protein is the building blocks of the body. You need enough protein to rebuild the tissue to get them stronger. And then recovery. You need enough sleep. You want to deal with stress and the basics. You just want to recover. So the basics of a good lifestyle so that you can heal from your osteoporosis and osteoarthritis. Where hands-on care fits in. So how does chiropractic care fit into this? So I'm going to give you some honest framing from 30 years of chiropractic clinical practice. So number 1, what can it do? Chiropractic can improve joint range of motion, reduce muscle guarding of the joints. So it can reduce the stiffness and tension that you have around the joint, release tight tissues around the painful joints. We can coach you on exercise form, posture, balance, and gait, reduce reliance on pain medications, because if you're moving more, we get those mechanoreceptors firing. Those are the joint receptors, and they tend to block out the pain receptors that are sending signals from the tissues to the brain. We can provide accountability between the visits. So checking up on you, giving you some encouragement, and working with you to improve your health. What it cannot do: reverse advanced cartilage loss, rebuild bone density on its own, replace daily strength training and good food, replace your doctor's diagnosis or testing, and do the work. That's yours between visits. So hands-on care accelerates progress. It doesn't replace the daily work that you're going to need to do. 3 habits, 30 days, pick 1 in each category and start small and show up daily. So get moving. 20-minute walk most days, or 2 short strength training sessions a week. That's a good way to get started. Eat a real protein source at every breakfast. Start your day off with protein. And then recovery. A consistent bedtime, 7 days a week. Go to bed at the same time, wake up at the same time. That'll refresh you so that you feel better. So show up small, show up often, and show up for a long period of time, for months and years. Now, if you want to take this further, your next steps are you can scan one of those QR codes and you can become a new patient here at the clinic. If you want to join our mastermind classes on osteoporosis and our osteoarthritis, we meet once a week for 4 weeks post-webinar, and we're going to talk about this in a deeper way. So we're going to do a deeper dive into this topic so you understand osteoporosis and osteoarthritis better. And if you want some one-on-one coaching, you've been diagnosed with osteoarthritis or osteoporosis, you want to get more into the meal plan, exercise levels, how to help yourself in between treatments, we offer a 13-week coaching plan as well. If you want to get our book called Strong Bones, Smooth Joints, it's now on Amazon. All you have to do is scan this QR code. It'll take you over to Amazon, and then you can get this book in paperback, ebook, and audiobook format. So thanks so much for joining me today. Hope you enjoyed this webinar, and I'll talk to you soon.